Part of the evaluation before we go into the procedure is also doing a very comprehensive assessment of if a patient is a good candidate for Zephyr valves, but even more so, it helps us give us an idea of what the target lobe will be. So a STRAX assessment is a very detailed assessment based on a high-resolution CT scan, and honestly, most importantly, is able to assess the collateral ventilation between lobes. So what that involves is using a system called the Chartis system. So what we do with our Chartis assessment during the procedure, just prior to placing a valve, is we blown up a balloon in a individual lobe of the lung and assess flow of air. If there's no collateral ventilation between the lung lobes, then eventually over time, the amount of flow being detected by that system and that balloon would cease. And that is a good indication, a very sensitive and specific indication that there's no collateral ventilation. If that's the case, what we end up doing is then moving forward for actual valve placement. The setting up and preparing to put the valves in is honestly much more detailed, the actual placement of the valves. Really the things we worry about in post-procedure is a pneumothorax, which is the collapsing of a lung, meaning that the lung has deflated very quickly. We can sometimes see a small tear in the lung that is expanding on that same side. If that occurs, we put a small chest tube into the chest. We fix it right in the recovery room. And then finally, getting our patients up to our acute pulmonary unit to be watched over by nurses who are trained in this kind of procedure.